I'm Nedra Kinerk, and I want to welcome Hidalgo County Medical Director, Dr. Ivan Melendez, to our Futuro RGV discussion on how the COVID-19 is affecting our Hidalgo County communities and what to expect in the months ahead. And Futuro RGV moderator, Felipe Salinas, will interview Dr. Ivan Melendez. And first, I do want to thank our sponsors. These sponsors enable us to do the kinds of things in getting information to our communities, and we thank them for their sponsorship. And so now, and I do want to say that these discussions and those of other Valley leaders will be on the Futuro RGV Facebook page, YouTube, and social media for further viewing. So, Felipe, you're going to talk with us with Dr. Ivan Melendez about what we are learning and how we go forward in the midst of this COVID-19 pandemic. And so I will turn it over to you and Dr. Ivan Melendez to help us understand what we are learning to help us cope with COVID-19 as we go forward. So, Felipe.
Thank you, Nedra. Thank you very much for having us here today. So, Dr. Melendez, welcome. Good to see you.
Thank you.
So, Melendez, let's get started. We all see daily reports from the counties here in the Valley that highlight the numbers of new positive cases and results and some test results and deaths. And I'm pretty sure those aren't the only data that you and your colleagues look at to gauge how we're really doing. So what can you tell us about what you are seeing simply in terms of the numbers and trends? Are we pretty much unchanged for the start of the surge earlier this summer? Are there any signs of improvement anywhere? Can you speak to us about that a little bit?
Absolutely. I think what's important for your audience to understand are that those parameters, that criteria, those numbers that try to give us a true picture of where we are with the penetration of the virus in the community, how we're dealing with it. Is it improving? Is it getting worse? Are we static? And by knowing that, then we know what the appropriate mitigation strategy is, and we know exactly where we need to change and adapt. So I think that's a really good place to start. If you don't mind, I'd like to back up just a little bit before that question, because I think that it's important for the audience to understand a more basic understanding so that you know what we're dealing with. You know, whether people believe in divine intervention or they believe in just a cosmic awareness of the universe, but about 4.5 billion years ago on this earth, there was a primeval environment where there was no life. It was lightning and lava and nuclear. It was a prime. And during that time, we see that the first forms of life were the coming together of ammonia groups and protein groups and very basic elements that did not have the capacity to reproduce and were basically a product of all those forces coming together to form these molecules to come together. Why is that important? That's important because I think most people do not understand what a virus is. And a virus is simply a recipe. It's a protease recipe that we divide into either RNA or DNA. And these are deoxyribo or ribonucleic acids, And what they are is simply recipes floating around looking for an oven, looking for a pot, looking for a cook. And so these very primeval, immature, basic life forms are floating about and have been forever. These viruses will require, depending if it's a plant virus, a bacteria virus, a dinosaur virus, a human being virus, it requires a host, an apparatus, a motor, a machinery to be able to reproduce. Most of us, of course, understand that at our level of evolution, we have partners and we reproduce, but viruses are very basic. A virus compared to a bacteria is like a cockroach compared to a dinosaur. And so there are bacteria that are infiltrated with viruses. So people need to understand that viruses are very minute, microscopic protein life forms that require a machinery to reproduce them. Why is that important? Well, that is important because viruses they don't have a brain. They're not smart. They can't make directions. That doesn't mean that they're not sneaky. That doesn't mean like this particular virus that isn't able to trick people into thinking they're not sick, because up to 80% of people have very little symptoms. That doesn't mean that these viruses are not sneaky in the sense that they can go to a family of 8 people and affect every single person different. This doesn't mean that they're not sneaky, that they're able to attack all organ systems. So this particular virus is very sneaky. Whether you believe that it was cooked up in a lab in China and it escaped, or whether you believe someone ate a bat, doesn't really matter for this discussion. What matters for this discussion is for people to understand that we are much, much smarter than a virus. We can certainly make decisions. A virus is just looking for one thing and one thing to do, which is to reproduce. Kind of like a 20-year-old in this world, just looking around, looking for a place to reproduce. So it's important that people understand what we're dealing with. Because we don't have any medications that are antivirals. We have very few. We've had them for years called Zovirax or Cyclovir that we use for the herpes virus. And then we have one that we've been using for the influenza virus. But we don't have any effective antivirals. Even remdesivir, which is the antiviral we're using now, the only thing that it's shown is that it decreases the amount of time people can stay in the hospital. It doesn't do anything to kill the virus. So just like the other pandemics that have occurred since the dawn of time, recorded time, probably the Neanderthals and probably the Australopithecus and probably the Homo habilis and probably the Homo erectus, who lived for 2 million years on this world, they probably had viruses too. Not probably, they did. But since recorded time, we've had pandemic after pandemic after pandemic. The most famous, of course, was 1340, Yersinia pestis. Yersinia pestis is a bacteria that was transmitted from rats through a flea. And therefore, Western Europe lost 1/3 of its population. In 1 year, 20 million people died. Compare that to what do we have now? 160, 170,000 that have died here in the United States. So even back in 1340, this plague, this pandemic of a bacteria called Yersinia pestis, known as Black Death, destroyed 1/3 of the population in Europe. And so because there were no antibacterials, there were no antibiotics. Remember, antibiotics are for bacteria. Antiprotozoas are for protozoas. Antivirals are for viruses. So because there was no antibiotics, just like right now, we don't have antivirus, we were pretty much in a similar situation in trying to kill this disease. So they figured out the thing called a quarantine. Quarantine meant that you had to stay in your house for 40 days because they realized that it was being spread from family to family. It took them longer to make the association with the rats and the fleas, but they knew right away that it was in clusters of buildings and families. So just like in 1340, now, the only way that you can control these pandemics is by not into another body. And so as long as this basic life form called a virus, in this case, the coronavirus, SARS virus 2, which is the correct name, COVID is the name of the disease. Right. This particular virus, if you do not allow it to jump from one person to the other, from one host to the other, 14 days, man, that virus is dead. Mm-hmm. And so just like in 1340, let's remember that 300 years later in London, 400 years later in London, there was another 70,000 people that died in the 1700s from Yersinia pestis. Let's remember that even today, we have 1,000 to 2,000 people dying every year from Yersinia or the Black Plague. The same bacteria that was killing folks off 800 years ago is still killing people today. That means that in all likelihood, this particular virus, unlike smallpox, which we're able to eliminate, but this particular virus will probably be around until the end of mankind, until the end of Homo sapiens. So the question is, how do we control it? And so the reason that I'm giving this background is so people understand, one, what we're really dealing with, two, the importance of that virus having an appropriate host, and three, this isn't going away. Now, the pandemic may go away, but this disease, from here to forth, in the future, people will get their mumps, measles, rubella, herpes, tetanus, influenza, pneumonia, and coronavirus vaccine. So we need to get used to it. Just like 9/11, things will never be the same, and we just need to accept that. Now, only God knows what awaits us in the next coming years, the next coming months. And so that's why we have to use this example, which has really been repeated and repeated and repeated with SARS and MERS and all these other coronaviruses. We have to use examples so that we don't make the same mistakes that we had before. Okay. Now, all these points I'm making to you, oh my God, I can expand on them, but let me answer your question so you can redirect me to where you want to go. So the question you asked is, in view of the numbers changing and having a more, I guess, positive perspective in numbers, what are we really looking for and where are we? So the numbers that you want to focus on this type of disease is how many people are hospitalized, how many people test positive of the total people that are tested, the percentage, how many people are in the ICU, how many people are admitted to the hospital, how many people are dying, how many people are on ventilators. These are the numbers that we look at because these are objective numbers. They don't play themselves to any subjective interpretation. If you test a lot, as President Trump reminds us, you expect to have a lot of positives. But we're not getting more cases because we're testing more. That's nonsense. We're getting more cases because it's spreading. So we look at the percentage of those people that are testing positive. We highlighted about 20 to 30% of the people being tested were turning positive. Currently in Texas, 1 out of every 4 people are turning positive. We're currently at 17%. Those are the numbers that we're having right now that are testing positive. We want to be
in Hidalgo County, you mean? In Hidalgo County?
That is correct.
Okay.
That is correct. So we're at 17% currently, and we want to be at 2% or less. That's when we know when things are under control. So we're far, far from being under control. So when folks look at the numbers and they say, oh my God, we had 1,200 cases a week ago, and now we only have 300, we're getting better. No, not necessarily. Because what you don't understand is that a couple of weeks ago, we were doing 7,000 or 8,000 tests a day. And now we're doing a fraction of that. And the reason why is because the federal government had allowed us to do a lot of tests through their federal testing. So that's why the public should not be fooled into thinking that because the number is less, the cases are less. It's the percentage. In fact, if you use the standard 5x, 6x multiplication of your positive cases, then in the Rio Grande Valley, specifically in Hidalgo County, there's probably 150,000 people out there, you know, with this virus. Not 2 or 3,000, 150,000.
Right.
So that's a lot of people.
Yeah.
So we look at that number. Second number that we look at after positive percent cases is the people that are hospitalized. So today there's a little bit above 500. 10 days ago, it was 1,100. So we're about 50% better than we were a couple of weeks ago. And so is that a good thing? Of course it's a good thing. That's an objective finding. That is something, so, okay, well, if you meet these criteria to be admitted, which hasn't changed, that means less people are being admitted. And so that is an encouraging number. And why that number exists, why that number has changed, we can talk about it if you want, but that's a number we look at. The third number we look at is how many people are dying. And so we still have a very high death rate. Up to 4% of those people down here that get it, that's a very high rate. Remember, in the country, it's around 1%. We're at 4%, which begs the question, why are people in the Rio Grande Valley dying at 3 times the rate of anywhere else in the country? That's another question for another discussion. But that's certainly what we're looking for, is that 4% positivity rate. I'm laughing because I have a colleague here, he can't find his glasses. The problem is when you wear glasses and you don't have them, you can't see to find it.
Right, exactly.
That's
a constant conversation. That's a conversation in our house all the time between all of us.
Where are your glasses? I can't find them. I can't find them. So, or what's even worse, when you go to the restaurant, you forgot why you went there. And so we look at the second number, which is how many people are being hospitalized, which I just mentioned is significantly better. Then we move to the third number. First was positive rates of all tested. Second was hospitalization rate. Now the third number we're looking at is death rates. Well, our numbers are equally as high. So that's a very discouraging number. People in the ICU, another number we look at, the fourth thing we look at, slightly improved, but still unacceptably high. Sure. So we were at 330, now we're at 245. Still dramatically above what we see.
What would you say?
Percentage of people in the hospital, those are COVID versus other diseases. I remember my census because I go to all 6 COVID units and all hospitals here in Hidalgo County. We had probably 90% of people were COVID. Now we're probably about 60% of people that are COVID.
Okay.
And so we see numbers going in the right direction. And it's easy to understand why, because what we were seeing was the backlash from people not paying attention during the 4th of July, Memorial Day, and those holidays where we grew up.
So speaking about that, I mean, we hear the constant call from elected officials, elected and health officials like yourself, you know, reminding people of the things that we need to do, right? Wear a mask, social distance, avoid gatherings. And so what you presented are some numbers are looking good, some are still concerning. Why do you think that, you know, we're still not where we want to be? Is it people aren't wearing masks, lack social distancing practices, social gatherings? What do you attribute this situation to?
Yeah, so the question is, why are the numbers still present? All the numbers are discouraging, although some are showing improvement, but all the numbers are discouraging. There's not one acceptable number. Our new baseline is still much higher than what we want. So let's be clear about that. Mm-hmm. People are hearing and they say, well, some numbers are good and some numbers are bad. No, all numbers are bad, very bad. What is good in isolated numbers is the trend. Some are trending better, but the actual number, you know, I'm 5'5". So if I weighed 350 pounds and I got down to 290, I'd still be grossly overweight. And so is 290 better than 350? Absolutely. But is it still a problem? It's a big problem.
Sure.
So are the numbers. So that's the way that you can analyze that. Before, if this problem was a boiling pot of water, all the water had boiled out and we had the bottom of the Teflon that was curling up. The pot was on fire. Now, someone's put just a lining of oil on the bottom of that pot. It's still empty, it's still boiling, it's still hot, but it's no longer cracking. Okay, why? Why are we where we're at? That's why I prefaced this conversation with a basic understanding of what a virus is and how a virus loves to live. So the reason that this continues, because number one, we're not gonna get rid of it overnight. Number two, our community is still giving the opportunity for this virus to propagate. Look at it this way. You're 29 years old. That's the average age in Hidalgo County. I remember when I was 29 years old, you know, back during the First World War, we were I was extremely hungry to be out and about, to have, you know, I was at UT at the time and I was having these philosophical conversations about, I was way on the left, you know, John Anderson, I tell you where I was at. And so, you know, when you're 29, I'm glad you understand that joke, because 9/10 of your audience will not. So, so at age 29, you know, biologically, we want to be out chasing our potential mate. We want to be out and congregating and changing the world in dialogue. Sure. You know, when you're our age, or say you're in your 40s, you're a lot more stationary. You want to stay home, and when you're our age, yours and my age, Felipe, we just want to stay home and chill. Sure. So we have a 29-year-old average citizen that's going about doing what 29-year-olds do. No matter what you tell them, they're invincible.
So is a good part of it just the fact who we are demographically? I mean, our median age is lower than the state and national numbers. Is that?
So that's one of the parameters.
Sure.
That's one of the parameters. Just to finish that thought, think about the way that we were designed biologically, either by God or evolution. We are geared, we're designed to come together. We're designed to light candles for each other when we see that there's a need. We're designed to want to hug. You know, I remember when I was married, the best part of my day was at night when I came home and my wife and I just hugged each other in bed, and just we were so blessed that there was two of us against the world. So we were designed to come together in times of war, in times of famine, in times of disease, in times of pain, and even in times of death, where we have the ritual of funerals. Well, this virus makes us go completely against what our natural tendency is. Yeah. So we are supposed to spread apart. But because the sneaky virus, it takes advantage of our idiosyncrasy. And so by us doing what our heart tells us, then we're still, you know, we're still in contact with each other.
Sure.
And that is a primary thing. Now, if you add number one or number two in the entire country in percentages of diabetes, Rio Grande Valley, obesity, Rio Grande Valley, poverty, Rio Grande Valley, lowest educational level, Rio Grande Valley, age, 29 years old, Rio Grande Valley, proximity to the border, which is a third world, non-existent health infrastructure with a porous river. So you get this perfect storm of people that have all the comorbidities. Now ask yourself this though, Felipe, well, why not Eagle Pass? Why not Brownsville? Why not El Paso? Why not other border communities that have the same ethnic background and they have the same problems that we have? Why are we even worse than they are? Good question, right? Yeah, that's a good question, man. So what's my impression of that?
Yeah.
I don't want to tell you.
Okay, all right.
I want to leave your audience.
All right.
Tell me. Well, because that is a real question.
Sure.
That is a real question. And the answer, in my opinion, is we have a lousy infrastructure, health infrastructure of primary care compared to other communities. Right. So if you're in El Paso, a lot of people have access to Fort Bliss, which is one of the largest forts in the world. And so there's a lot of VAs and their dependents, a lot of veterans like myself and their dependents. If you're in other communities along the border, I think they've done a better job that even though their population is sick, we call that your pre-morbid status, before disease status. They're sick, we're sicker. For example, everyone who's diabetic knows what a hemoglobin A1C is. That's a measure that tells you how well your diabetes has been controlled for the last 90 days. It's called hemoglobin A1C. Yeah. You want to be around 6.5 at the most. So let's say, for example, in El Paso, the higher the worse. So let's say in El Paso, that hemoglobin A1C in its diabetic population, instead of being a 6, it might be a 9. But in the valley, it's a 12. So our people, by the time they get to the hospital, are sick, and they're a lot sicker. So the reason that I believe that the Rio Grande Valley is even worse in our numbers is because our baseline status of health is a lot worse. Think about this, Felipe. Hope Clinic, Milagro Clinic, that's it. Where else in a population of 1.2 million people, even if you go to the residency programs that they have for the students, you still have to pay. And so something, even $10, $15. So I think that we need to learn from this experience and understand that we need in the future more resources from the state and federal government and the county government, we get it from the state and federal, to establish better primary care sites. So when we get the next pandemic, we're not as sick. Our diabetes is better controlled. So, our obesity is lower.
Yeah, so that was one of the questions I wanted to ask you. It's in looking forward, I mean, part of the reason for this entire series is what are we learning from this experience? What do you see are some of the primary things that we as a community need to advocate for? And you're touching on one of the reasons that we're at where we're at right now is because of the infrastructure is not where it needs to be as far as healthcare. Can you speak to that a little bit more in terms, I mean, the legislative session's coming up, you know, there's election season coming. I'm not, you know, not necessarily saying vote for whoever, but what we as citizens need to be informed about to advocate to improve the situation in an area like the Rio Grande Valley going forward? What are the 2 or 3 main things that we need to push for to try to be sure that we're better prepared for the next pandemic, or that we are beginning to chip away at that poor infrastructure?
Yeah, so I think there's 2 ways to divide the question. The question is, how can we better be prepared in the future should we have another horrible crisis like this? And the question is, and what can our legislative folks and the system itself do so that we're much better prepared next time?
Sure.
That's the question. So I think we need to divide that answer into 2.
Okay.
I personally believe, in the way I was raised, and I'm sure you're the same thing, we're the same generation, is that you have some personal responsibility. You know, you can't be with your hand out waiting for the government, whoever that is, to come and resolve your issues. So we need to take personal responsibility by doing local stuff that's going to get us ready. Like what? Well, first and foremost, you have to love your neighbor. You have to have love for your community. You have to respect each other. Even if you disagree with somebody, you still need to love them. And if by going out and exposing people, that's the complete opposite of love. That's disregard. And we need to stop cutting in front of each other in our emotional and spiritual line. We need to stop not returning the $2 extra that our waitress accidentally undercharged us. We need to stop that nonsense. And we need to understand that we need to love each other and have personal responsibility. There's only one group of people that are responsible ultimately for why things are so wrong. And that's us.
Right.
That's us. The doctors, the hospitals, our local legislative folks, and the community.
Right.
We should have already been doing this and said, man, we really need this. And the community should have said, man, I need to lose weight. Man, I need to control my diabetes. Man, I need to find a way to access healthcare. So it's not the governor's fault. It's not the president's fault. It's our own personal responsibility.
Sure.
So first and foremost, I'd like to answer that question by saying, we as citizens of Hidalgo County, like your organization doing Futuro is, we need to raise an awareness that we are a community. If you go to Manhattan, or you go to the east side or the west side, or you go to San Francisco, they have a sense of community. They have a sense of we're all here from different parts of the world, as we are here also, and we need to have a sense of community and work with each other, okay? So second way to answer this question, or to address this question, in my opinion, is how can we get help? What is the help that we need from those of us that control the purse strings, from those of us that can give us the logs and a lighter fluid, if you will, to start that fire, being our state and our county and our federal government? Well, I think first and foremost, we need to understand on a federal level, we're Americans. We're Americans. Those of us that served in war, like myself, if your last name is Yang, if your last name is Garcia, if your last name is Smith, if your last name is Jackson, it doesn't matter if you're Black, Asian, Hispanic, Anglo, we're all Americans. And so just like Hurricane Maria in Puerto Rico, those poor folks were completely, in my personal opinion, underfunded, underserved, for whatever reason. I'm not into the politics of it, just the fact of it.
Right.
People were not addressed. And you know what? They're just as American as you and I. They're American citizens. So first and foremost, at the state level, at the federal level, because if you're from Iowa, Indiana, New York State, California, wherever you're from, a lot of us don't look like folks who live there. But yet we're just as American as they are. And so first and foremost, create a awareness that the Rio Grande Valley is not some middle of nowhere backhoe country bumpkin place. We do liver transplants, we do kidney transplants. We're the Mecca for medical care south of San Antonio. We have more hospitals than anywhere else in South Texas. We have 1,500 physicians from all over the world. We have people from Ivy League schools. So we're not unsophisticated. We're under-resourced. And so from a federal level, understand that we are Americans, and that it's not because we're ignorant. It's not because we don't have the technology. It's understand because we've been under-resourced. Now, secondly, and this is my own personal observation, perhaps a little politically incorrect, but you can tell, man, I'm not running for anything. So I think that human nature is to put your resources on those lines of service that are profitable. So a heart transplant, a liver transplant, a kidney transplant, patient hospital stay, hospice, all these are profitable lines of service. So it's our tendency for our healthcare industry, myself, I mean, I can't remember the last time that I volunteered my services at a nonprofit primary care center. I mean, I'm not going to throw a stone and not take some responsibility too. But we've designed these lines of services that I believe have been prioritized by which is more profitable versus not. So it's not infrequent when someone says, well, do we do a rehab or do we not? And they look at the numbers. So we need to shy away from that and say, we need to establish primary care resources. When we try to get a hospital district going, it's always beat up. People just vote it down because I'm paying South Texas Community College. I'm paying school, municipality, county, and people are saying, I'm not going to pay more taxes. Okay. And then the misperception, I think it's a misperception that, and if I do, and we get this money, it's just going to go to the hospitals. And they're already, the $1.5 billion people in town. So why should I vote to enrich them?
Sure.
So we need to find ways where we can ascertain that our tax dollars are not redirected to other parts of the country for those people to distribute to their investors, but that are placed here so that we can staff for primary care clinics.
Right.
That's a federal and state level. From our local politicians, or let me put it this way, I don't know why politician has such a negative connotation in the year 2020.
Right.
So let me say our elected officials, our representatives. And I might say that the ones that we have here at the county level, or which I work with, have been extremely receptive. They've been extremely, their priorities have been exactly the same as mine, which is what's in the best interest of the health of the community, not financial interest.
Sure.
Unlike other folks in other parts of the country who put a really strong impact on the financial aspect, they do too. But I have not made a recommendation yet, regardless of the financial impact, that our elected officials, the commissioners and Judge Cortez, have said, no. It's gonna cost too much money. People are gonna go broke. They always say, is that the science behind it? And I say, yeah, here's the science behind it. And they've always listened, which I'm grateful of that. So federal resources, state resources, our local folks also need to understand what the needs are from people like myself, from people like you, and then fight for those things. And I think one of the advantages of this pandemic is that it's created an awareness from our elected officials that we need to prioritize a little bit different in the future.
You mentioned that we want to wrap this up in just a couple more minutes, but I did want to ask you, you touched on the fact of how our health system is, driven by the bottom line often in terms of where hospital systems decide to invest their resources. However, it seems to me that we've seen in the Valley, here in Hidalgo County, you mentioned you work with the 6 hospitals that have COVID units. It seems to me, my impression is that there's been a lot more coordination and conversation between them all. Normally they're in competition with each other, obviously, to a certain degree. They're owned by different companies. What has it been like working with them from your point of view?
Yeah, from the public health perspective, look at it this way. The chief executive officers, the chief financial officers, the investors, they live here too. Yes. Their kids go to school here too. They're part of the community too. Some people argue, for example, that an elective surgery, like a knee replacement, for example, that people say you need to stop that stuff and you need to prioritize and do life-saving stuff. But you know what? Ask the person who can't walk because their knee hurts so much. Yeah. Ask the cancer patient that has a tumor in their breast that has to wait while that cancer continues to grow. How do you define what's elective and what isn't? I would argue that other than cosmetic surgery, the vast majority of whether you're getting a knee replacement or you're getting a gallbladder that can wait with antibiotics, these surgeries need to continue. That being said, yes, there's always been a healthy competition between the 4 major systems here, if you refer to the hospital system. There's the UHS systems, the Columbia Regional system, the Prime system, which is the one in Knapp and the one in Mission. And then the 4th, of course, is our local Doctors Hospital Renaissance system. So those 4 people, those 4 groups of people, of course, have always been highly competitive, and which is good. Competition makes us better. When you have 4 vendors instead of 1, I guarantee you get a better product. And you're right. Once the impact fell, then we would have multiple meetings weekly so that we could, and the word is collaborate. And so the collaboration between the hospitals has been, I think, applaudable, not laudable, but applaudable. I think that they've come together and they've said, how many beds do we have? How many ventilators do you have? What can we do to make this better? How can we centralize this? Do we do one COVID hospital or do we split it amongst all the hospitals? So there's been a tremendous amount of collaboration, not only between the hospital systems and the county health department, but also among the, and I hate this word, among the providers, the physicians. I don't like being called a provider. So yes, I think there has been a tremendous amount of collaboration.
That's great. Well, as we want to wrap this up, you talked a little bit about some of the lessons that we are learning in terms of policy, where we need to do as a community and so forth. I want to just close by asking you, what has been your biggest learning experience personally this entire
Yes, can you hear
these
me
last
okay?
several
Can you
months,
hear me okay?
especially? Yes, yes,
Yeah.
yes.
You froze a little bit. Okay.
Oh,
So
sorry.
what has been my personal epiphany during this? My
Yes.
personal moment of truth that an old man like me who served in Iraq and Afghanistan was on the forefront when HIV first came, and now with this pandemic, an old man like me who has kids that have gone through their big kid. I always believed were inherently bad. You know, I never had to teach my children to not share. I never had to teach my children to not cry. I never had to teach my children not to run around in the restaurant. I never had to teach my children bad stuff. They knew it already. It came from inside them. And there's a school of psychiatry that says man is basically bad and he has to learn to be good so he can get along in groups of people. Otherwise, you're out. Well, I'll tell you that when I've been tired, when I've been exhausted, when I've put my sixth grade school teacher on life support, where some of my dear friends that I've worked with for 25 to 30 years next to me as a nurse, where I've put chest tube central lines and they've died in my arms, where I've played videos to cadavers because I promised the children that I would play those videos. And you come home and you're crying, you're exhausted, you're overwhelmed. And when you get home at 1 a.m, you get to your front door, what do you find? You find a package from UPS. It's cost somebody $13.35 to send you a Don't Give Up poster or some masks that somebody somewhere, name unknown, from New Jersey, another from California, saying, hey, we heard about your plight and we're there for you, man. We love you guys. And so what I've learned is that there are good people. I mean, I'm reminded that there are people that are good and that they care about each other and that they love each other. And that for me, because we get sometimes, I guess the word is bitter or hardened, I guess is a better word, hardened by all the travesties that we see every day, people dying in front of us, that there's still some good people. And you know what that does, Felipe? That gives you hope. That gives you hope in humankind, that people are going to get some awareness and start being more community sensitive and community involved. And so that to me is big, biggest learning experience. And I couple that about 3 years ago, I had a death experience. I got very sick. And so I didn't expect to survive. I was very, very sick. And in that moment where you're being coded and you're dead, I always thought when you heard God, you hear like Charlton Heston in the bushes, you know, Melendez. No, you know, when you hear God, you hear it in your own voice. And you hear and you say these crazy things that you don't even use those words. How could it possibly be you? And I heard a voice that said, sit still. You're going to be okay. I'm with you. Sit still. And what the heck was that? Then I heard, you know, don't worry. I'm not through with you yet. There's still stuff for you to do. And I got so scared, like in one millionth of a second. What do I have to do? And immediately, don't worry, you'll know. And so since I had this experience, I believe that this time right now, with the experience that I have of 30 plus years, with my being a true clinician, my ability to articulate points, my not needing anybody's money or anybody's recognition, because that's where God has taken me, that this is the time. This is my Super Bowl. This is my major leagues. This is a moment where all the skill sets that not only myself, but all the people, all the healthcare providers of the community have. This is where we need to bring it on and then use every skill set that we've been developing and that we've been blessed with to put this thing to sleep. Right. So those have been my two largest learning points.
Wow. Well, thank you very much. I mean, we've seen you on the national news and the media, and we thank you for the work that you're doing and explaining to the nation what's happening here, but also for everything that you do on a daily basis in the rounds that you're making and visiting the COVID units. And thank you for sharing your story with us and some of your insights. We really appreciate it. Thank you, Dr. Melendez.
Absolutely. I thank you for the opportunity.
Great. You to wrap up.
Well, Dr. Melendez. I anticipated this would be very interesting and informative, and you exceeded my wildest expectations. Your explanation and review of viruses and the analogies you use, man, you would make a good teacher. You are a good teacher. And I'm reminded when my sister and I had measles back in the 1930s, the county health director came around and put a sign on our front door that said measles quarantined.
Wow.
Maybe we need some more of that.
Yeah, wow.
Anyway, I think people like you convince me that there's always a rainbow after a storm. And this pandemic storm, people like you are going to make sure that we do have a rainbow. And I firmly believe that the things that we learn as we go through this, there will be a rainbow. And I want to thank you and all of the people that you work with and all of those people who are going through this pandemic with terrible afflictions, both medically and economically. You make me believe there will be a rainbow. I want to thank you very much.
Well, thank you so much. We can never lose hope. Can never lose hope.
You're exactly right. That's what
Thank
John
you.
Lewis said.
That's right. Thanks for your kind words, Nedra. That's very kind of you.
All right, if ever Futuro RGV or I personally can help you get your message out, please let me know.
Keep the candles burning.
I will do
Keep
that.
the candles burning.
I
Thank
will
you so
do
much for the opportunity. Okay. Thank you, guys.
Thank you
We'll
very
see
much.
ya. See ya. Bye.
Bye-bye.